but it can happen anywhere on the body that there is a hair follicle. Okay, so we know that we've heard all of this information about under breasts, in the groin, and armpits, right, are the most commonly, affected places that we hear about all the time. But what most people don't know is that it can happen anywhere on the body that there's a hair follicle. And that doesn't mean there has to be an actual hair present there. So we have hair follicles pretty much everywhere with the exception of the palms of the hands, the soles of the feet, and the red part of your lips. Other than that, anywhere on the body is fair game for HS. It has a huge impact on the quality of life, mentally, physically, emotionally, financially, and that's just to name, the first few that start. HS doesn't discriminate against age, race, sexual orientation, intellectual or developmental disabilities, blood type, geographic location. Any single person in the world is susceptible to HS. So we hear a lot about the areas, that it may affect more as far as African-American females, or females are more affected 2-to-1 than men, or 3-to-1, excuse me. But not all of that is necessarily true. We're in the middle of a huge influx of information about HS, and there is truly, it feels contrite to say this, but there is no better time to have HS than right now. We are finally in the spotlight, and we are getting the notoriety that we deserve and have deserved for a really long time, you guys. So it's a good time to have HS. There is a ton of new information coming out, a ton of clinical trials, a lot of interest in our condition. So we are learning more and more about our condition every single day. As you guys know, there's no cure for HS, and our treatments that we have so far aim to control disease severity and to help reduce symptoms. So we don't have a cure, but we do have now 2 FDA-approved medications, both of which are biologic medications, and there are a ton more in the pipeline. This is what I mean when I say it's a good time to have HS. There's a lot of action happening and a lot of things going on right now. So this is kind of just a chart that we put together about where you can get HS. There's most commonly affected areas, like we talked about, that we're always mentioning over and over. But it can develop anywhere on the body with the exception of the palms of the hands, soles of the feet, and the lips. So you may end up with HS right around your mouth or around your lips, but that does not necessarily mean, like, it can't affect actually the red part of your lips, but it can affect anywhere else on the body that there is a hair follicle. So it's really important to note that. And there's reasons why it affects those specific areas so often, and we'll talk about that kind of as we get into it. So I know there's a lot of questions that usually come up about how do you tell how bad your HS is? And this Hurley staging, it was named after Dr. Hurley, and he is the person who came up with this concept, and it was originally used to determine who is a candidate for surgery. But it's kind of morphed and now has become the Hurley staging system that is used on a regular basis for those of us in the US. There are a couple, I know of at least one other staging system, but it's not commonly used in the US. So the Hurley staging is basically used to determine the severity of your HS. There are 3 Hurley stages. So you'll often hear, oh, I'm a stage 4. There is no stage 4. You can be a severe stage 3, but there are only 3 Hurley stages. And the best way to look about it, or to think about it, is it's the amount of affected skin in an area. So the less affected skin, the lower the Hurley staging. The more affected skin, the higher the Hurley staging. So some of the things to remember about Hurley staging, you can have different Hurley stages on different parts of your body. So you can be a Hurley stage 2 in your armpits and a stage 1 in your groin. It doesn't mean that you are the same Hurley stage in all of the locations. So that's important to note. It is also important to note that it's not guaranteed that you're going to progress in staging. So just because you start out as a stage 1, it does not necessarily mean you're going to become a stage 2 or a stage 3. You may end up progressing to a stage 2 and stopping there. So it's not necessarily, a death sentence, so to speak, that you are going to be a stage 3 if you start out at a stage 1. We know tons of people who stay stage 1 their entire lives. You can also go backwards in staging. So, and most of the time that's usually done like through surgery and surgical options. But you can go backwards in staging, which is a really nice thing. You can also go into remission. So I've had surgery and I consider myself in remission now. Because of my surgery, I was a severe stage 3, and now I don't have super frequent flares. And that was the answer for me. So now I consider myself a stage 1. So it's possible to move throughout these stages. And again, there's other scoring or rating systems that are used around the world, but the Hurley staging is the one you'll most commonly hear, and I'm sure all of you guys have heard about it. So one of the things that we constantly are asking about, everybody says, well, like, all awareness is good awareness, right? I mean, as long as we're talking about HS, that should be good enough. No. And the reason why is that factual and accurate information is so important, and it does matter. And the reasons being is because it helps stop the shame. We can help people get accurate and timely diagnoses. Appropriate treatment can begin. And stigmas about HS, as all of us know from our personal experiences, stigmas about HS hurt people and they hurt disease awareness. So if we're constantly spreading misinformation about our disease, we're not going to be able to get people to come to the forefront, accept that they have HS, and speak out about their condition. And I don't know if for any of you, that was a huge deal for me. I personally carried my HS as a secret for about 27 years, only letting the people know who were like intimately involved in my life about my HS. It's a really heavy burden to carry. That shame and that secret is really heavy. And what we want to do, and especially HS Connect, we really want to lessen that shame and that stigma that people feel. And the only way that can be done is by spreading accurate information about HS so that we make sure everybody knows that it could affect them. And part of that is stopping the shame that comes with this HS by letting people talk about their HS. Our goal is for HS to be just like type 2 diabetes or hypertension. No one feels that sense of shame when they talk about having high blood pressure. And we want HS to be represented just like that. It's a medical condition and it should be reflected just like that. So we need to lessen the shame and lessen the stigma so that everybody feels comfortable coming forward about their disease. So let's get on to the misconceptions about HS. Now that we've kind of talked about what HS is, I will say they still do not know exactly how HS happens. That's still being studied. They're not sure if it's the follicular occlusion that happens first or the inflammation, chicken or the egg. So they're still in the process of figuring that out. But some people will ask, well, how do we have treatment options then? Which is a totally valid and good question. They are identifying the pathways that the inflammation is affecting, and those medications that we have are impacting those inflammatory pathways. So that's where we're coming up with the medication as they're piecing all of this together to figure out how exactly it happens and how it occurs. We're at least able to identify some of what creates that inflammation in our bodies, and that's what those medications are targeted towards. So how many of us have heard this, and I hear it all the time and it makes my skin crawl? HS is rare. It's really not rare. It's rarely talked about. And most of us know that because it's not something sexy and it's not something that we're proud of and just put it out there in the forefront for most of us. It's not rare, you guys. It's thought that it impacts 1 in every 100 people. So think about that in the context of, I was in the airport yesterday and I created a quick video for an Awareness Week project that we're doing about this. I'm 1 of 100 people in that airport with HS. There are thousands of people in there. How many other people are walking around with their HS hidden? Think about it in terms of sporting events. How many people in those stands have HS? On that plane, what, there's 200 to 300 people? I'm not the only person with HS on there. And I think that that's actually, it's probably more than that, but that's what all of this work that we're doing right now is figuring out. So it's estimated that 390 plus million people worldwide have HS. Okay, that's not rare. It's just rarely talked about. And like I mentioned, right now there's not accurate statistics regarding HS. And the reason being is a lot of people don't know that they have HS yet. They haven't sought treatment for their HS. They've been misdiagnosed. It's maybe occurred in their family for a lot of years, and it's just something they've been told they just need to deal with. So these are the things that making sure factual awareness is coming out about is helping us to get actual numbers. So there are quite a few projects underway right now where HS is being looked into more deeply about who is mostly impacted, and what does that look like in a global perspective. And again, the only way to change this is to stop the stigmas so that people come out about their HS. So we're going to talk about a couple of other misconceptions and things that happen and why that's so important as we get into this. So this is one of my favorites. It's rare in men or more common in women. So all of the data and the information we've seen so far says that it appears in the US anyway, that it impacts 3 to 1 in a ratio of women to men. Especially in Southeast Asia and other countries, men are actually more commonly afflicted than women. So what happens here when we constantly talk about how it's rare in men? How do you think that makes men feel about coming out to talk about their HS? If they think that it most commonly happens in women, and that's the narrative that we've been giving for all of this time, and they think, well, I don't fit this demographic because it's rare in men, I have it on my back, so it can't be HS, but it is. And we keep telling people that it is rare in men. And that's where these kinds of problems come up. And this is what we're working so hard to stave off and to change. So again, in other countries, it affects men more than women. And the reason we don't know the reason that is yet. And there's a lot of work being done on that as well. So it could be a societal thing. It could be class systems. It could be that, men are more likely to seek care outside of the home than women in other countries. Could be social burdens, cultural differences. I mean, we don't truly know. It's one of the things that I am enamored by and cannot wait to try to figure more out about. And we all know typically that men are less likely to seek medical care and speak out about their condition in groups, and that plays a major role in statistics. So again, we know that men are affected potentially just as likely as women are, but we don't know and don't have that proof yet because we are still talking about how it doesn't affect men in the same way or at the same rate that it affects women. So thinking about that, these are kinds of things that when you see these misconceptions out in the community, it's a great time to kindly remind people that HS can impact anyone, including men. And we are seeing more and more men start to speak out about their HS, and then as more men follow that trend, hopefully we'll be able to see them, recognized as equals. So again, misconception more common in women, especially, excuse me, African-American females. So this is where some of the real life experience that we have doesn't necessarily mesh up with the data that is coming out about surveys and studies and things like that. So for me, the answer is we don't truly know. And with respect to the specialists and researchers, the data that continues to circulate is based on a handful of studies, most of them being from only a few geographic locations. So that plays into the statistics that you're going to get out of one location versus a nationwide study that's going to encompass everything. True prevalence requires multiple studies, not just from a few geographic locations. And we do know that there is a lack of participation from other ethnicities and races in clinical trials, surveys, and studies, which means it's even more important and more difficult for us to get those actual numbers, because we're not getting people necessarily to stand up. We know, and we've heard this from multiple institutions that we work with and educational institutions, people that reach out to us to help them get surveys and studies completed. We hear constantly that 95 to 97% of the surveys that we put out are completed by middle-aged Caucasian women. So we need to make sure that we're getting the diversity in these surveys, in the studies, in the clinical trials, so that everyone is represented in there. And much, much more research is needed in this area, and that is happening currently as well. I'm sure every single person has heard this one about weight. Most of us on the first visit leave the doctor's office being told two things. We need to lose weight and quit smoking. Even if you're not a smoker, it usually comes out of their mouth at some point. We know that weight can contribute to the severity of your HS, but it is not the cause of your HS. Please hear me. Your weight may contribute to your HS, but it's not, and I just see that I spelled cause wrong, the cause of your HS. So we know that a link exists between metabolic syndrome and HS, but again, it's not the cause of your HS. And sometimes the reason that you can get HS flourishes more potentially, and this is what we were talking about earlier in the locations piece, is because the microbiome of the skin, where you have skin rubbing skin or touching other skin, can create the perfect environment for HS to flourish. So microbiome represents kind of the makeup of your skin, and it's different where you have skin touching skin constantly, like a fold in the stomach or in the groin. Those tend to be perfect places for your microbiome to grow in a way that invites HS. So that's why it typically, can happen in those areas for most people. But again, it can happen anywhere on the body there's a hair follicle. We see it in different locations on men as well, like on the back of their neck and on their backs. We've seen HS in the crook of an arm. It's all over. People on the head, face, neck, everywhere. So it's really important not to discriminate that it's not HS because it's not in one of the typical locations. So we know that there are many thin people who also have HS, and that HS does not discriminate against or about your weight. It's an equal opportunity offender, unfortunately. But it's definitely important to know that your HS is not your weight is not the cause of your HS. It may play a role in the severity of your HS, but it is not the cause. As far as age goes, again, we don't truly know. We hear all the time that it's most commonly developed during puberty. I personally started getting HS at around the age 10. I didn't get my period until I was 18. So we don't know what is actually happening that's creating it. I think that there's so much more to be discovered about this. But what we do know is that HS can happen at any time. So we see children with HS. We see postmenopausal women with HS. Unfortunately, for most of us, we've heard at some point in the past, like, oh, well, as soon as you hit menopause, it should be better. I wish I could tell you that that was the case, but it's not. There are some women who develop it after menopause. There are some women who it becomes worse after menopause. There's really just no way to know. So there's a lot of work being done on this as well. And there are studies that have come out that said that if you develop HS later in life, like in your late 30s or 40s, that it can tend to come on harder and faster than if you had developed it earlier. So we know there's something happening here, and they're working on putting all of that together. But it's just really, again, it's important not to just look at it as a disease that happens during puberty, that it can happen at any time. And again, all of these other stories are not being told as loudly as the ones that say that it comes on during puberty, because they may not be there may not be as many of them, but we're starting to see these things come out more and more. Some women develop it after giving birth to a child for the first time. There's really no specific time. It can happen at any time. And we'll do some Q&A at the end too, so hang on to things and I'll answer what I can. So another misconception, we talked about this one kind of ad nauseum, but it's worth putting in here again. Location, location, location. So if we were real estate people, this would be our jam. It can impact anywhere again on the body. So it used to be called atypical HS when it was anywhere outside of the buttocks, groin, armpits, and underbreasts. But now we're really trying not to call it atypical HS, because for people who live with HS in those areas, it is anything but atypical. For them, that is absolutely typical. So it's just kind of reaffirming that we need to make sure that our language is in check when we're talking about HS, and not automatically discounting someone because they don't have HS in one of the typical areas. And we're still seeing this happen at the dermatology offices where they're like, oh, well, it's on your back, it can't be HS, because of the lack of education about the disease. So sometimes, as you guys have known in the past, I'm sure, when you go to a derm appointment, sometimes you have to educate your dermatologist on things. That is not rare, unfortunately, for HS, because it is not something that is widely talked about in the derm field. They get little to no training on HS. And we're working to try and change that too, because based on how many people it impacts, this is not, again, a rare condition, and everyone should be, in the know about HS. So this we hear all the time, that it's a sweat gland illness. So even the name, hidradenitis suppurativa, alludes to that it's a disease of the sweat glands. If anyone has looked up how hard it is to change a name of a disease, you would get why I think this has been abandoned. It's like a 10-year process. We don't even know honestly what to call it at this point, because we don't know exactly how it happened. So there is no good second name for it. But this is not a disease of the sweat glands. We have seen people have mastectomies because their doctors have told them that they will get rid of their sweat glands and that they will not have the same problem anymore. This is not true, you guys. HS comes back because it's not a sweat gland illness. So it's really, really important that we're clear on this. Short and sweet, it's not a sweat gland illness. That's outdated, old information. It's been proven inaccurate, which is why you can get it anywhere on the body other than the places where you have the majority of sweat glands. Even if they wanted to remove all the sweat glands, it is impossible to do that. You can't even physically do it. And people talk about having their glands removed because that's what they were told by surgeons. But again, that's inaccurate information. And it does not help because it's not a gland illness. That's not to say that not having affected areas removed would not be helpful as a surgical option, and it absolutely is. But the difference is when you're talking about having a procedure done versus having sweat glands removed. So it's really important to make that distinction, that it's not about the sweat glands. If it was, you would only get it in specific areas, but we know that not to be true. Oops, let me move this over. And then one of the other misconceptions that I think a lot of us have felt, at least, is that we're not cleanly and that HS is happening because we have poor hygiene. I think that comes from the odor that comes with our HS, unfortunately. And a lot of times when you have draining tunnels or you have an abscess rupture, there is zero we can do about this. So it's really important for ourselves to know that this has nothing to do with our hygiene, and that we are typically more aware of our odor than anyone else. When I was in the height of my HS, I was acutely aware of the smell. And I'm sure if anyone needed perfume, I was the girl. I had it. There were multiple, scents in my purse because you were always worried about that. And we're very, very aware of our body and the odor that we put out. But we also have to be careful that overwashing can do more harm than good too. While we have both good and bad bacteria on our skin, it's important for both of those things to be in place. They all have a role. So if you're constantly washing with antibacterial soap, you're actually killing off the good bacteria that is on your body for a reason as well. So it's really important to kind of keep the antibacterial products, I wouldn't say to a minimum, but maybe only on the affected areas so that the rest of your skin can maintain that balance in the microbiome of having the good and the bad bacteria. We don't want to go too far one way or the other. It's kind of about that balance in the middle. And then contagious or an infectious disease. So any of us who have potentially had encounters with sexual partners who were concerned about catching HS, this is a misconception. There is no catching HS. It's not contagious. It's not an STD. And most of us have had to experience or explain to somebody at some point that this is not contagious or infectious. So the reason that we're typically prescribed antibiotics, and people will say, well, it must be an infection because you're getting an antibiotic. And I thought the same thing for a really long time until I started becoming an advocate. And the thing is that antibiotics have anti-inflammatory properties in them. And we are typically provided with antibiotics because of those anti-inflammatory properties, not necessarily for the actual, for any kind of an infection. Now, we do get antibiotics for infections when they do happen. And most of those infections are secondary infections, meaning that an abscess would drain and can become infected due to the bacteria on the skin. So most of the time, if we get infections, it happens as a result of an abscess opening and then bacteria getting in that way. Many of the abscesses, if they want to culture them, they come back with a mix of, regular bacterias in them, nothing outlandish, or they may come back free of harmful bacteria. So a lot of times our abscesses are sterile in that they don't have any mass of one kind of bacteria or another. So keeping in mind, we're given antibiotics for anti-inflammatory properties, but they are also given at certain points for secondary infections as well. And then the reason our abscesses smell is a combination of dead white blood cells and bacteria, tissue debris, serum, and living and dead microorganisms that are underneath that skin creating that abscess. So that's why they smell. It doesn't do us any good to know that, exactly why that is. But I feel like in some cases it helps alleviate that feeling like it's our fault that they smell. And that is a typical thing for HS. Anybody who has encountered other people with HS at the same time or been in a group of people with HS, most of the time, we're aware again of our odor and we can smell it on other people. And it's almost a sense of like, okay, it's a normalcy thing for a lot of us, which can seem very strange. All right, so next we know that this is hotly contended in the community, whether HS is autoinflammatory or autoimmune. Right now, and there's constant updates being done and new research coming out, but as of right now, HS currently resides in the autoinflammatory category. So the way that we figured out the best way to talk about this is that autoimmune, the body attacks itself. With autoinflammatory conditions, the body overreacts. So our body is overreacting to stimulus that is creating this inflammation and follicular occlusion. So for some people, that could be sweat, it could be friction, it could be clothing, the list goes on. It could be food. It's an endless list that could be a trigger for your body. But basically what happens is our body is sensing whatever is creating that inflammatory condition and that inflammatory response, and then it's sending out all of the attackers to it. So it's overreacting to a minute stimulus in most cases that is creating all of this inflammation underneath. So it may be an autoinflammatory illness related to our innate immune system. So there's a link, and it's a lot of language and verbiage that can be very confusing. But honestly, at this point, our body is overreacting. So when we're taking medications like biologics, what is happening for us is that we are coming back to normal. So our body is already in a heightened sense and a heightened state. With biologics, it's bringing it back to what a normal person would be. So when we're on biologic medications, our immune system is not compromised. Our immune system is constantly in overdrive. It is working far harder than it needs to be. And a biologic medication helps bring it down to normal, which is supposed to help try and keep all of that inflammation at a more normal level. So we're not necessarily immune compromised when we're on a biologic. We're actually more immune regulated when we're on a biologic. So it's one of those interesting things that for normal people with a normal immune and auto or inflammatory response, it probably does bring them down and lessen their immune system. For us, it doesn't really do that. So they've shown through COVID and everything that it was fine. And taking biologics were not harmful to anyone's immune system during that time as well. All right, next we have words to avoid. So kind of what we had talked about throughout this, these are the things that we are trying to work on avoiding. Cyst, boil, and glands. Again, the best way to do this is we know that through social listening that the most commonly referred to, most commonly way that HS is referred to is as a boil. So what we've done is kind of married that together and brought it into more of an HS vernacular. Boils are their own diagnosis entirely. There is not a recurrence that comes with boils. So when we go to the doctor and we say we have boils, they're looking at it as a different diagnosis than HS. If you say we have boil-like abscesses, that is a completely different thing. So this is where vernacular and the language comes into play, although it may seem like, why is that important? It doesn't really matter. It does, because if you're diagnosed with boils, you're not diagnosed with HS. They're two completely different diagnoses. So moving those together in boil-like abscesses is a really great way to kind of merge all of that together and lead people more towards what we deal with, which are abscesses. Skin on skin or skin folds, we often hear that, especially from dermatologists. Oh, well, it can't be HS because it's not where skin touches skin. Again, reminding people you can get HS anywhere on the body. Armpits, groin, and most common areas. Again, you can get HS anywhere. Women between the ages of 20 and 40, anytime you can get HS. The way that we like to phrase it now is you can get HS anywhere, anytime, anyone, anywhere, anytime, excuse me. So anyone can get it at any age, anywhere on the body other than the palms of the hands, soles of the feet, and the lips, and at any time in your life. So that's pretty broad spectrum, but it's accurate. So when we talk about all of these really pinpointed specifics, think about all the groups of people that are being left out thinking that HS couldn't impact them because they're not between 20 and 40. They didn't get it during puberty. They don't have it in those specific locations. They're skinny. They don't smoke. You know, all of these things. We have to make sure that we're being inclusive about who can get HS. That's the only way we're going to get actual prevalence data about HS and really know who is being impacted. So using things like this instead, boil-like abscesses anywhere on the body, it's not a gland illness. There is really currently no robust research showing the impacts of smoking on HS. Yes, losing weight and smoking is good for your general health and overall health. No one's arguing with that. But as far as your HS specific condition, there is no robust information coming out about this and smoking and weight. In fact, there are things that have come out about weight, even just in patient stories, where people have lost weight and had gastric bypass or a different surgery. And as a result, they have more hanging skin, which is actually creating a worse HS for them than before they had surgery and lost weight. So there are some flip sides to some of these things. It's not a one size fits all disease. It's not a one size fits all answer. So keeping those kinds of things in mind, that it can impact anyone from children to postmenopausal. The microbiome is different where skin touches its skin, making it a popular place for HS to develop. And there's no true robust research on men versus women and African American dominance in the disease. Again, these things are coming out and being discussed more and more. So this is a great time, again, to be kind of in the leading edge of research. And this sun, I'm just going to say, is absolutely luscious because I'm outside of Seattle and we don't get it very often. So I'm not even closing my blind. Not mad at it. So how can you help? Educate yourself on your disease. HS Connect is a great place to do that. We have articles and videos. We have a YouTube channel. We have Instagram, Facebook, everything, TikTok. Share your story. Openly talk about your HS. This creates awareness, and you may be really surprised at who shares that they have HS too. When I came out about my HS at work, before I had a surgery, there were 2 other people in my small office that also had HS. So you would be really surprised at how much can be done just by opening up about your own personal experience. And I think that it's a wonderful place to start. Don't be afraid to kindly educate others, kindly being the most operative word here. Most don't know anything other than what they've been told, which is inaccurate information. So first of all, there's no one is to blame here for having inaccurate information or potentially spreading inaccurate information that you didn't know yesterday was inaccurate. Now that you can know more and do more about that. It's important also to really remind yourself and others constantly that HS is not your fault. Again, the burden emotionally and mentally of this disease is so heavy that constant reminder to ourselves is so important. So please remind yourself, remind others, this is not their fault. And then again, we have so many factual and accurate resources on our site. We work with the top HS experts in the field. We go to a ton of conferences. I'm literally home for less than a week and I leave again on Monday to go to another conference. We are out and about everywhere, learning, gaining knowledge, soaking up as much information as we possibly can. So please always feel good about sharing HS Connect as a resource. We have a medical advisory board and we also have HS specialists on our regular board as well. So we're well covered. So the bottom line is that you make a difference. No matter where you are, what you're doing, who you're talking to, you are making a difference in sharing information about HS. You're bringing more people to the forefront. You're bringing awareness about the disease to people who may not have it, but to help them understand what it's like to be someone with HS. Because the chances are you're probably not the only person they know with HS as well. But most people won't bring it up and talk about it. And it's a brave thing to do when you do bring it up and talk about it. And I encourage you to practice that. Start out with the people who are closest to you. Have an open conversation with them about the way that it impacts your life, about the ways that you wish you could show up differently, but that HS kind of gets in the way of that. The more vulnerable you are, the more people will understand. And our goal is to normalize HS, which means we have to take that step to help other people understand it. A side note on that, people will never truly be able to understand what it's like to live with HS except for other people with HS. So setting an expectation that's realistic for yourself about someone like your partner or your friends or your family being able to really understand, They're not going to. It's the same thing if you've been through a battle with another health condition that no one could really understand what that's like except people who have gone through that, and HS is no different. But I think it's really important to try to help people to better understand what it's like so that we can normalize the condition, stop spreading the shame and the stigmas that are out there and happening, and make sure that we're open to sharing our journeys with the world as we feel more comfortable doing that. And then next, so we're having this is going to be a 12 session patient webinar series, education series that we're doing. And again, sponsored by Sanofi and UCB. And our next one is going to be next month in June, and it's going to be about CBD use for HS. So we definitely, registration is going to open for that soon. If you haven't subscribed to our site, do that at hsconnect.org, so that you'll get information about when the registration is open for this, and it will be soon. And I can't wait to share that with you guys. There are so many different things that are being looked into as far as alternative medicines and alternative pain relief and things like that, since we know that we're not at the place we need to be as far as those kind of reliefs, for pain and all of the things we deal with HS. So people are constantly looking for alternative methods, and this could be one for people. So we want to get that information out. So thank you again for being here, for showing up. And again, it's recorded, so it's going to go on our YouTube channel when it's done. And then we're open for questions and everything, but look out HS World, because here you guys come. It's been amazing. Thank you for hanging in there with me and letting me chat your ear off for the last 45 minutes. If you have questions, go ahead and put them in the chat. I would be happy to answer what I can. I'm not an HS specialist, although I like to think I play one on TV. But happy to answer anything or have discussions about what HS isn't, how things have come up. So please feel free to put anything in the chat or pop on and turn on your camera. I'd be happy to address. But thank you guys all so much for being here. I really, really appreciate it. It's so important that we get all of this information out, to the world, and to everybody, so that we can stop, dealing with the shame and stigma. Okay, so we've got some questions coming in here. What are some ways to manage flares? I have recurrent flares now, and so you have a 15-year-old who has flares as well? Okay. So a couple ways that flares are managed. It depends on if you know what your triggers are. It's totally okay to not know what your triggers are. Let's start out by saying that. I didn't discover any of my triggers until I was working from home when COVID happened. It's okay to never know what your triggers are. Sometimes that happens. Managing flares is difficult. I think it really depends on if you get more flares around cycle, then that is usually a hormonal issue that could be helped with potentially spironolactone or birth control. If you're already seeing a derm, then that's wonderful. If you don't have a derm, check out our derm list on our website. These are specialists that we've used from the HS Foundation's list, and then also some that we've gotten referred by other patients as well. So I would check that out for sure. One of the things you can try that's easy is clean body wash. It's called CLN. I'll put it in the chat here. And they're on our product suggestion page. And it's autocorrecting, sorry. Their body wash I did a survey study for them, and we had 63% of people in using it for 4 weeks experienced a decrease in the number of flares and how long their flares lasted. So you can also take a dab of that body wash and you can put it on a flare if you feel it coming up. And in some cases, that's enough to just cut it off. So definitely check out our product suggestion page, because we do have some coupons on there for clean body wash. They offer a really nice hefty discount for your first order. So that's a great place to start with that. And then you guys, my email is on here too on this last page. So if you have specific questions, feel free to email me. I'm happy to help. And then what kind of antibacterial detergent can we use? So again, I would kind of steer clear of the antibacterial detergent. I think are you talking detergent as in laundry soap or like body wash? So if you want to answer that one, then I will. Laundry soap. Okay. A lot of people use like the free and clear kind of laundry soap. It kind of depends on what you're looking for as far as if you're needing stains to come out or something like that. So a lot of people with, because typically we have more sensitive skin than other people do when we have HS. So we do know that a lot of people use like the free and clear kinds of detergent. And then Hurley stages, can you go from a 3 to 1, or is that you're always a stage 1, 2, or 3 forever and it's just well managed? That's a really good question. I think in some cases you're staged based on the worst stage you are on your body. So I think it's possible. This is a really loaded question. So I think it's possible to go from like a 3 to a 1, but again, that was with the help of surgery. Typically, without the help of a surgical procedure, when you are a stage 3, that things like tunnels don't necessarily heal themselves, as most of us know. So I think without surgical intervention, I don't know that it's possible to go from a 3 to a 1. If you do have surgical intervention, then I would say yes, you can. And then it really, again, it's going to depend, Juliana, on whether you have surgical intervention or not. But I think if you go from a 2 to a 1, you can. But the stage 3 means you have a lot of scarring and not a lot of unaffected skin on your body or in those areas that you have HS. Felicia asked if there are seminars and conferences we can go to. Like I said, we're doing one per month here. I would also check out our website. We have our YouTube page has a ton of interviews that we've done with other people, with specialists, with patients, the whole thing. So I would definitely check that out. There is a conference happening in Detroit this weekend. I think you can log on virtually or sign up to attend virtually. And that would be at AHSID is the name. It's of that conference that's happening. I think it's called I Reclaim. So you can check out their website. It's the Association of Hidradenitis Suppurativa and Other Inflammatory Diseases. They're having a one this weekend in Detroit, but like I said, I think you can do it virtually as well. And then we'll be there talking about how to use, how to cross over from advocate influencer to influencer advocate. So and then yes, the upcoming registration information will be posted on the Facebook page too for the next webinar. Absolutely, that'll be on our page. What about when HS is diagnosed as part of a syndrome? Is it then autoinflammatory or autoimmune? That's a really good question, and I am not qualified to answer that. I think that there's a lot of things that kind of coexist. I also have lichen sclerosis, which is considered an autoimmune disease. So I personally consider myself to have an autoinflammatory and an autoimmune condition. I'm sure that there's a lot of interplay between that, but I think that's a really good question. And like I said, can't really answer that from a medical standpoint, but it's something that we should definitely look into more. Deodorant, I've tried all on the market and they trigger me. My last experiment was Native. I know that a lot of people have tried Lumi as a deodorant, and they have found that works for them. The nice thing about Lumi too is that they also have a cream deodorant. So, sometimes when we're using an actual like stick, it can be really difficult to put on without pain. So maybe give that a try if you haven't tried Lumi. It's Lume. Oops, let me. Lumi deodorant may be an option. Oh yeah, Kara is gonna be there in person. I can't wait. And then let's see. Surgery was stage 3, and after that, I don't have something. Yes. So, Juliana, you're pretty much in the same boat I am. Stage 3, and then had surgery. Now I'm like a stage 1. I consider myself a name or a stage 1. And then has there been any discussion about HS and gut health? And has there been any correlation with diabetes? Yes. So yes to both of those. The HS and gut health is a really hot topic and hotly contested. I think there's definitely 2 schools of thought on it. So I don't know too much about the research on that, but that's a good thing to bring up and potentially try to do a webinar on with somebody who has more information on that than I do. And then if there's a correlation with diabetes, yes. So type 2 diabetes and HS, type 2 diabetes is a comorbidity, a common comorbidity of HS. So there is definitely, there's a correlation there to diabetes for sure. And then, okay, so you tried Lumi and that didn't work. I don't have any other ones. Honestly, I don't wear deodorant anymore after I had wide excisions in my armpits. So I'm not the best person for this, but I have also heard that people have used like the crystal deodorant, I think it's called. So it may be one that it's just really hit and miss. And I know that that's the hardest thing to do is we're constantly spending money and time and energy on products like this, trying to find something that works. So, and then there's some HibaCleanse is honestly the best cleaning, takes the smell. Yeah, so the thing with HibaCleanse too, Felicia, is you don't want to overuse it because it kills, again, the good and the bad bacteria and is very drying on your skin. So you want to use it only two to maybe 3 times a week. And you definitely don't want to put it where there's any, oh my God, I just totally lost the word for it. But you don't want to use it where there's any mucous membrane. So like in your vaginal area or anything like that, you really want to avoid that, making sure it's just on the skin itself, because it can have an impact on anywhere there's mucous membranes. So the thing about clean body wash is that you can use it every day, and it's along the same lines as HibaCleanse. It's just more gentle on your skin. It's basically the equivalent of a bleach bath in a bottle. So, and if your skin can handle it, great. I just know that we have so many people that cannot handle the everyday because of the drying. So it's something to just keep in mind. And then it looks like there were some questions on surgery too, about what kind of surgeries. So we have on our site, there is an article about surgeries and all the surgical options for HS. We even, at one point, we will be putting out more information in regards to the clean body wash as well, because we did that survey study. So it is getting published, so that we'll have some actual backup for that as well. But the surgery piece of it, there are quite a few different surgery options for HS. And there's usually a surgery option for everybody if they need it. So if you're a person who has a recurrent flare, that keeps coming up, draining, coming up, draining, coming up, draining in the same spot, that is the perfect situation for a de-roofing procedure. And de-roofings are when they go in, open up the top of the abscess. A lot of times they do that with a punch biopsy, like they would do to check if you had skin cancer. And they open up the top of that, and then they check on the inside for any tunneling that may be happening. And if they do find tunneling that's happening, they will open up the top of that as well. They scrape out the inside, which you're numb for all of this. But they scrape out the inside, and then that's clearing out something called biofilm that lives in our abscesses and is what makes it really, really difficult for us to heal some of these wounds. You'll notice we have wounds for years and years. So, and that's because of the biofilm that's in there. It's kind of like a sticky gelatinous texture. So they scrape that out and then they leave it open to heal from the inside out. So it's a great procedure. It takes maybe, I mean, depending on how big your area is, maybe 2 weeks at the most to heal. It hurts a hell of a lot less than having a recurrent flare that's constantly there. You know, and so it's something you can definitely look into. Like I said, on the site, we have an article about procedures and surgery. And then we're also working on more information with Dr. Stephanie Goldberg, who is an HS surgeon, about the different procedures as well. And then Tony asked, what is the best underwear to wear during the summer to prevent chafing? Ever since I found out about men's boxer briefs, that's all I've worn. So that may be a really good option that you want to look into. I found that men's boxer briefs are equivalent to women's boxer briefs, but they cost a hell of a lot less. For some reason, when you make a woman's boxer brief, it instantly becomes 3 times the price of a single pair of men's. So I would maybe try that. There are some other options, like maybe Thigh Society has some. On our product suggestion page, Tony, you can also check on there. There are some other options for undergarments, both bras and underwear, that may be helpful to you to try. Again, it's unfortunately with everything with HS, it's not a one size fits all. So what works for one doesn't work for another. It would be a heck of a lot easier if it did. So that we could just, you know, have our one size fits all, but no such luck. So I would definitely check out the website too to see, you know, if there's something on there that catches your eye. And again, maybe try the men's boxer briefs I get at Target are their Goodfellows brand, and it's like $15 for a 5-pack of them. So I'm happy to like start trying those and then build up from there if you needed, you know, something else to try. So I hope that this has been helpful for everyone. It's 5, so I will let everyone go and enjoy the rest of your evening. But thank you again so much for joining. And again, if you need any assistance or any help, feel free to email me. I am happy to respond to you and help with whatever I can. And then again, so subscribe if you haven't already so that you get the information about when the CBD webinar is coming out. And then after that, we have one about self-advocating and you know, being an active partner in your care and how to do that. So I can't wait to share those with you. And again, thank you guys so much. Have a wonderful evening.